Here we are in this humble setting. I promise nothing crazy, no green screen, no royalty-free or public domain assets, no casting, no small children, animals, or sentient goose jesters, not even as much as a key light, just simple diegetic lighting. Sure, I've got this lav on, but that's just to ensure optimal sound. I even left my recording rig in the basement. Seriously, nothing crazy today. It's just you and me exploring a couple questions about the impact of exercise on chronic kidney disease. Short and sweet. Shall we begin? I don't see why not. So Ryan, give us a little background. What exactly is a kidney? Nobody knows for sure. Dude, this is no time for jokes. We've got a grade on the line here. Maybe you've got a grade on the line. You're me! That's troubling. What did you do? Nothing, I swear. But hypothetically, if I committed a crime... That's the same as me committing a crime. What did you do, Ryan? So kidneys, right? These remarkable little organs/glands are involved in regulating metabolic processes, removing waste products and toxins, and producing urine. What did you do? But we're not here to talk about kidneys. That's all we're here to do. We're discussing chronic kidney disease and how exercise impacts its development and progression. Let me tell you, that is some serious stuff. How serious? Well, you see, CKD is characterized by progressive and irreversible renal dysfunction and structural abnormalities. That sounds like one truly horrible condition. That's just it. Chronic kidney disease does not occur in a vacuum. It's not like you're just strolling along one day and BAM! Your kidneys shut down. What do you mean? CKD isn't a lone wolf, but rather a progression from one or more pre-existing conditions. Look at them all, and that list is by no means exhaustive. With so many comorbidities and potential causal factors, how does somebody even know they have chronic kidney disease? Well, first of all, there's the signs and symptoms. You've got fatigue, nausea, hypertension, lower extremity edema, not to mention possible anorexia and chronic heart failure. You said, first of all, is there more? Oh yeah. Diagnosis comes down to three main criteria: the cause, GFR, and albuminuria, otherwise known as proteinuria. GFR? That stands for glomerular filtration rate. Normal GFR is about 125 milliliters per minute per 1.73 meters squared, but anything above 90 is considered normal. Then what? If your GFR drops below 90, you're entering stage 1 of CKD. It keeps getting progressively worse as that number goes down, with 15 milliliters per minute per 1.73 meters squared being the threshold to end-stage renal failure. And what did you say about albumin? That's albuminuria or proteinuria, same difference. See, albumin is a protein that's involved in tissue building and repair and fighting infections, but it belongs in your blood, not in your urine. As urinary albumin concentration goes up, so too does your risk of developing or worsening chronic kidney disease. Well, there's a lot more to chronic kidney disease than I originally thought. You're telling me? Or are you telling yourself? Don't make it weird. What's weird about having a conversation with myself? So, exercise. It's a thing. Yes, well, is exercise even safe for CKD patients? Is it ever? Not only can people with chronic kidney disease exercise safely, the benefits improve quality of life and can even improve GFR. Wow. Any other benefits? Totally. Studies have demonstrated improvements in blood pressure, sleep, functional capacity, arterial stiffness, cholesterol, insulin resistance, glycemic control, aerobic capacity, muscular strength and size, and exercise tolerance. Exercise tolerance? Yeah, it turns out that chronic kidney disease does a real number on a person's capacity for physical activity, not to mention exercise. Combine this with sarcopenia, you know, age-related muscle loss is also induced and exacerbated by CKD, and you can see why this disease ravages a person's physical capacity. I can only imagine the toll that CKD must take on a person's spirit. True, but exercise has been demonstrated to improve the symptoms of anxiety and depression in people with chronic kidney disease. Sounds like exercise is a great idea for combating kidney disease. Certainly, but you still have to be cautious. The goals of training CKD patients should focus on low intensity work and a gradual increase in volume. Moderate intensity exercise can be quite effective, but remember, tolerance time and aerobic capacity are significantly reduced by CKD. I bet a lot of patients need dialysis, and they probably need kidney transplants
Dialysis
too.
is a good idea, and it can be really effective at countering CKD.
Patients are even encouraged to work out not just between dialysis sessions, but during too. Just be mindful of fistulas and IV supply lines. Note that intense training may contribute to disease progression. However, post-transplant, vigorous training like you would need for sports is well tolerated. But it's still important to follow appropriate programming guidelines and work up to such intensities slowly over
Speaking
time.
of programming, what are the guidelines for program design regarding chronic kidney
There is
disease?
no ideal training prescription for CKD patients, but following generally accepted principles while being mindful of the exercise tolerance is the best advice. Again, start with low intensity exercise and progress slowly over time to increase volume. And don't forget that there will be medical setbacks. This doesn't mean give up, it just means be patient.
Any specifics?
With aerobic training, aim for 3 to 5 days a week. A goal of increasing session time to 30 or 40 minutes. Intensity of around 40% to 59% heart rate reserve is a good place to start, and CKD patients can remain in this zone for the majority of their training plan. Try walking, jogging, cycling, swimming, aquatic exercise, and monitor the rate of perceived exertion throughout a session.
What about resistance training?
Absolutely. Weightlifting is great for improving mass and strength, combating sarcopenia, and improving vascular function. Using free weights, machines, or even body weight, people suffering from chronic kidney disease can develop strength with loads of 60% to 70% 1 rep max, even go 80% intensity with appropriate training experience, and aim for 2 to 4 sets of 8 to 12 reps. On the lighter side, with loads less than 50% 1 rep max, people with CKD should aim for 1 or 2 sets of 15 to 20 reps to develop endurance. This should be done on at least 2 non-consecutive days. Flexibility shouldn't be overlooked either. At least 2 a week, but ideally 7. 2 to 4 sets of 10 to 30 second holds should do the trick. Patients can choose from static, dynamic, or neuromuscular stretches, aiming to stretch all muscle groups.
Okay, so if I got this right, CKD typically results from the progression of other health conditions, and it results in disordered function of the kidney up to the point of complete failure. It's safe for CKD patients to exercise, but their tolerance is likely quite diminished by the disease. With that said, moderate intensity is the way to go, both cardio and weights, but such intensity can also contribute to disease progression, so it's important to vigilantly monitor individuals' fatigue, tolerance, and effort. Doing so can combat the cardiovascular components of CKD and lead to improved kidney function.
Sorry, I wasn't listening. Too busy admiring myself.
You're just staring at me.
Exactly.
That's it. This interview's over. Thank you for your time.
Wait, I didn't even tell you what I did earlier. But everybody thinks you did it.
I don't want any details.
No problem. I'll ask the questions this time. You can't hide a donkey in a trench coat.
That's not even a question.
Not anymore.
This isn't where I want